So the ORION-9 trial was presented at the American Heart Association Scientific Sessions, and it's tested about 450 patients with heterozygous familial hypercholesterolemia, and the study drug was inclisiran. Now it's interesting because we've had about a quarter century of reducing LDL cholesterol from statins to ezetimibe and now to PCSK9 inhibitors. So inclisiran actually also targets PCSK9, but through just a different mode of attack. It prevents the translation of PCSK9, but ultimately it reduces the LDL cholesterol levels through the LDL receptor. So inclisiran was tested versus placebo in a randomized double-blinded trial in ORION-9. It's a phase 3, but the endpoint was change in LDL cholesterol over a period of about 18 months. And inclisiran reduced LDL cholesterol levels by about 45-50% or so in that period of time. There were very minimal side effects. There were some skin site where the injections, because it's a subcutaneous injection, but these were pretty mild and overall it seemed very well tolerated. Now, we don't know yet if the FDA or the EMA will approve it, but it is going up for approval. And if it does get approved, then the patient population would be the high-risk ASCVD or the heterozygous familial hypercholesterolemia, as well as were tested in ORION-9, because it reduces LDL cholesterol. Now, LDL cholesterol is a surrogate endpoint. It's not clinical outcomes for myocardial infarction, stroke, and CVD deaths. So we're awaiting that with the ORION-4 trial that's ongoing, large study, international, 15,000 patients. And that will be ongoing for a few years. And also we await the long-term safety data. In fact, actually the ORION study populations are being followed with this follow-up for safety extension studies. So we want to also wait for those as well. But very exciting data, and it's nice to have another tool in the box to reduce LDL cholesterol.